majority of adults say stress connected with the coronavirus has had a negative effect on their mental health, and the experts say some children are suffering the same effects. Navigating the New Normal, Parents Edition, is a new special by the Viacom CBS Learning Service, Noggin. It offers tips for parents worried about their kids' mental well-being.
My son found me crying in the pantry the other day, and while I needed the release, I felt bad because I felt like, oh no, is he going to feel like I can't handle this situation?
Number one, that this does give us a chance to model for our kids what it's like when we're feeling really sad, when we're feeling really overwhelmed.
The special's lead expert is California Surgeon General. That's Dr. Nadine Burke Harris. She joins us. She's a pediatrician, so she knows about working with kids. Good to see you, Dr. Burke Harris. That was Jamie Sigler, by the way, from The Sopranos, who said, my son saw me the other day crying. And I want to start with that because I think a lot of parents are wondering, is it harmful for your children to see that you're showing stress or anxiety? Is that okay?
Well, I think that what kids really need to see is that we have these feelings, we have these emotions, and then what do we do about them? It's not that they can never see us experiencing stress or anxiety, but this is an opportunity for us to model for them, wow, I'm feeling really frustrated and upset right now, and here's what I do for myself, right? And that's the really important thing.
Yeah, what are the mental health concerns you have for children right now? Because, listen, they're taking their cues from their parents, but they must be feeling some stuff too.
Certainly. We see that, a lot of kids are feeling a lot of uncertainty, a lot of anxiety. And it's really important for people to know that it's not just in their heads, right? Both for kids and adults, the experience that we're having is pretty stressful. And when we talk about stress, really, it's the body making stress hormones. And these stress hormones can do things like affect our sleep, affect our mood, affect our judgment. For kids, it can affect the way that they learn, and it can even affect our health, right? For example, high levels of stress hormones can make us more susceptible to infection, for example, by affecting the way our immune system functions. So helping kids understand what they can do to help to be healthy and, reduce those stress hormones, I think is really important.
We flashed it on the screen briefly there, doctor, but what are some of the signs that parents should look out for that say to them, uh-oh, my child's having a problem here, struggling a bit?
Well, it depends on the age of the child, but for littler ones, some of the things that we see are developmental regression, right? So, for example, if a child was previously potty trained and then they go back to wetting, or if they had been sleeping through the night and then they go back to getting up. For school-age children, you might see increased likelihood of, difficulty focusing or paying attention, or headaches or tummy aches. So sometimes school-age children really feel it in their bodies. And for teenagers can be tough to flesh out anyways, right? But they can become more withdrawn, or they can become more aggressive or angry, right? And then it's really important to reach out and check in.
You specialize in the connection between mental stress and physical health. What are you focusing on? Why is that important?
Yeah, so what we see is that there's a large body of research that shows that when we experience significant stress or adversity, particularly in this developmentally critical period of childhood, that it can affect things like brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. So science is now understanding that our environments, and especially in childhood, have a significant effect on our health, not only during childhood, but also throughout life. And what that means is that we can put that science into practice to make sure that kids are having safe, stable, and nurturing relationships and environments.
All right, Dr. Nadine Burke Harris. I knew you worked with kids when I heard your mic check and you went green eggs and ham instead of A, B, C, D, or 1, 2, 3, 4, 5. Thank you. Very good to see you this morning. Thank you so much. You can hear more from Dr. Burke Harris in Noggin's Navigating the New Normal special. Just go to the CBS This Morning Facebook page for more information on that.